the agenda under new business of the minutes of the September 4th meeting. Do we have a motion to approve those minutes?
Motion to approve.
Second. The next item on the agenda for review is the Tobacco Control Monthly Report submitted by Caesar, Program Director.
Yes, hi there. I just want to call attention to one item in my report. As you can see, there were several violations that occurred recently during compliance checks. 3 of those violations were sale to minors, but the 4th one was actually an entry, failure to stop a minor from entering an adult-only retail tobacco store. And I think that's important for you to know this, because before you tonight, or at least for discussion, you have a Kratom proposed regulations that this time is looking at the possibility of prohibiting the sale of Kratom in the city as opposed to restricting its sale to adult-only retail tobacco stores. So if you have had a chance to go through the proposed regulations, we can have a little discussion about that right now. I have only one observation that I want to make on the draft. It's the same one for the previous draft that proposed to restrict the sale to Kratom products. Is on number 7, on page 2, number 7. It says the following: upon the commission of 2 or more egregious violations of this regulation within 36 months, as determined by the Lowell Board of Health, the board may issue a notice of intent to revoke a permit and shall hold a hearing in accordance with regulations, and after such hearing may permanently revoke any permits held by the violator, including any permits to sell tobacco products in Lowell. The reason why I'm calling attention to this particular provision is that it has an inherent problem with it, because you haven't defined what an egregious violation is. This regulation doesn't define that either. And we see that every now and then in regulations, language such as this one here. The problem is that, when you want to call something egregious, you haven't come up with a definition for that yet. Then that's going to boggle things down the line. Well, yes, because this was based on the draft that I got from Belchertown. They had that in, so I want to be as inclusive as possible, because we can cut things down if necessary.
Why would we leave it 2 instead of 3? Because in the other part, talk about fine 1, 2, and 3, with the third one being 30 days and 5,000. So there's already described punishment for a third offense. Why would we not make this after the third one as opposed to after the second?
You could, right. So both languages are very similar. First offense is $1,000. Second offense is $2,000 in suspension. Third offense is $5,000. Well, third and subsequent offenses is $5,000 in suspension, right? So this would include anything that would come down the line. But if you wanted to have the option to also revoke a permit, which this board has if you issue that permit, then we could have language for that matter. But this language here I think is problematic because it overlaps with what you see on the schedule under Section 2. So one suggestion would be, okay, now if you have a 5th violation in 36 months, that's an egregious violation, and then you'll be up for a revocation. That's one way to simplify that. Or you come up with a very specific definition for what an egregious violation is.
Can I ask you a question?
Yeah.
When it comes to this herb, is there any chance that an entity would sell it by mistake? So we've had issues where sometimes with blunts and other things where you could argue they were mistakenly selling something that they didn't realize they shouldn't be. If we were to ban this outright, is there ever a situation where they could sell it and not realize they were selling it? Because that itself would be egregious to me if they were selling it at all. Unless you tell me it's possible it could be hidden somewhere and they didn't.
Right, so that's your definition of egregious, right? So the way this would work is, obviously I can note, if you decided to pass a regulation that prohibits the sale of Kratom products in the city, then, my first action would be to publicize this in a newspaper, also send letters to tobacco retailers, and I could try to send letters to other types of businesses, but that's almost like an impossible situation because there's so many different kinds of businesses in the city, and in theory, any one of those businesses could decide to sell Kratom. So if I came across a situation where let's say it's a clothing store, and they're selling kratom, and they claim they didn't know. I'll note that in the record. They remove it immediately, and if there's a second time, then, we apply the penalties prescribed in the regulation.
There's definitely in the literature some examples of people labeling it as something other than kind of like potpourri.
Oh, you're saying
So
mislabeling?
it could be misleading for someone who may not.
Well, the ones that I've seen so far, they're clearly defined, they're clearly marked as kratom. And I think it's a marketing strategy to say, hey, no, this is kratom. Otherwise, it's going to be upon the retailer to say, hey, even though this doesn't say it's kratom, we actually selling, this is kratom. I don't think they'll do that, but there's always a possibility.
So,
But even if-
go ahead.
Sorry. So based on this, even if a store that isn't a tobacco seller does something twice and we're calling that egregious, it's, if we've issued that permit, we can pull it. But, so if a clothing store is selling kratom, we didn't issue a permit to them to sell, so there's nothing that we could do to,
Right, if you have not issued a permit to a type of store that's been found to be selling kratom, then the only thing you can apply are the fines.
That just might create a little bit of an unfair burden on tobacco selling entities since they suffer a much greater loss than another entity would. I mean, I'm not saying it's not appropriate, I'm just telling you that it creates a little bit of a dichotomy.
Right, I think that the discrepancy is because some of these establishments, they've been selling tobacco for many years, so they know how these rules operate. This will be very similar to the rules that we have for tobacco right now, so it wouldn't be a stretch for them to adjust to this one here. What I usually see is that when people do engage in violations such as this one, it's because they do it deliberately. Like, for example, the 18-year-old girl that was able to get into the adult-only retail tobacco store 2 weeks ago, she knocked on the door was locked. She was buzzed in. She walked in. Halfway into the store, they decided to ID her. So they knew they were doing something wrong, but they took the risk. Now, but let's say like a clothing store, using that example still, I mean, if they don't know anything about these products and all of a sudden they're selling products like kratom, there's got to be a point where I get in contact with them. If somebody reports to us, hey, there's a clothing store selling kratom products, then I respond to that complaint, and if I find they have kratom, I could decide to fight them on the spot, or I could decide to just have them remove it immediately, and then, they put a notice. The next time this happens, then they'll suffer the consequences as provided in the regulation. I mean, there's no way to make this even because
Right.
different types of
You
stores.
could also argue that the tobacco selling stores are getting much more education on it because you're going to be sending them specific directives on it versus to every retailer.
I'll say the tobacco retail stores will be more inclined to be more cognizant of how these operate, yeah.
Did you have anything else you wanted to say on the kratom topic?
No, I just want to say that, if you want to consider this regulation, either one of these two regulations, I think that clause number 7 needs to be changed, either removed altogether, or if you want to have the ability to revoke, you can just come up with a simpler rule. If you have, let's say, 5 violations in 36 months, that's an egregious violation, then we can revoke your permit. Although, my understanding is that even if you don't have revocation language on the regulation, if you find a retail store is not able to conform to the regulation of the city in any way that gives you confidence, then at some point you can just bring it over for a hearing and then revoke that permit if you decide to.
The law department would have to review whatever we adopt anyway, right?
Whatever you decide to go for, then the next step will be to send this to the law department for their review.
So they could address if there's a, standard definition for egregious per the city's codes versus whether or not we need to be specific, you think, or
I'll have to submit it with a request for them to review that clause.
review it and see what they recommend?
Yes.
Yeah, thank you.
Do we have anyone who wishes to speak on the kratom issue? You could, if you wouldn't mind coming up to the podium and stating your name and address, please.
Good evening, board members. First of all, thank you for allowing me to speak. My name is Linda Trueville, and I am here in a couple of capacities. First and foremost, I am here as a grieving grandmother. My 25-year-old grandson, Tyrell Truvel, died earlier this year from kratom, mitragynine toxicity. And I can't begin to tell you the devastation that our family has experienced because of his death. To have to watch my daughter Holly mourn her only child and being able to do nothing about it has brought a pain that no other parent should have to witness. Tyrell was one of the lights of my life, and I was so proud of the young man he was. He was hardworking and full of life and zest. Who would have thought that a kratom seltzer drink that was labeled as non-alcoholic, caffeine-free, and sugar-free would take his life? My second capacity here is as an elected official of the Dracut School Committee and trustee of the Moses Greenlee Town Library. In addition, I am a director member of the Dracut Scholarship Foundation and a member of the Wellness Committee for the Dracut School System. I also speak as an educator and administrator for over 54 years. I tell you this, as all of these capacities involve young people, where much discussion surrounds how to keep our students safe from drugs and other substances that could harm them. The Dracut District has been approved to participate in the Massachusetts School Wellness Coaching Program Tier 1 for this school year. So the results of this coaching to update our wellness policies goes hand in hand with your important discussions. I have brought the attention about kratom to the Wellness Committee and the Dracut Board of Health, and this is something that we're going to have further discussions on. I look to this board as the front runner to assist us in protecting children and young adults in Lowell and in the surrounding towns where kratom is being sold. I have grave concerns that kratom is being sold less than a mile away from Dracut High School at a corner gas station. If the members of the board ban kratom, that will set a precedence for all surrounding towns. And as communities that overlap each other in many different ways, we need to look out for each other. And if it hasn't been on other towns' radars, it will be now. I can assure you that it's on mine. And to regulate does not make kratom any safer. All it does is raise the age to buy it and where it can be bought. My hope, as a grieving grandparent and an educator, is that this board ban kratom. As Nelson Mandela stated, education is the most powerful weapon which you can use to change the world. And until enough education is done on kratom, it should be banned. Thank you for listening to me.
Ms. Trudeau, I'm sorry, I just need your address.
I'm sorry?
I just need your address.
15 Skiripo Way, SCHIRIPO, Dracut.
Thank you.
Thank you.
Good evening. For the second meeting in a row, my name is Eric Gitchier. I live at 34 Livingston Avenue, the city of Lowell. I represent the city council. We, back a couple months ago, we took a vote to ask the board to ban kratom within the borders of the city of Lowell. And the reason why is we did our research. We did mostly what I'm sure all of you have done, and we see it's an extremely tough position to put any store owner or anybody trying to regulate whether it's being sold or not, whether it's in a clothing store or if it's in a gas station. We have a hard enough time even regulating those. And this is something that we had somebody speak just last meeting who was in favor of it, but yet they got caught selling something they shouldn't have been doing, something they shouldn't have been doing. So, I mean, in all honesty, I find it very hard that we'll be able to actually regulate it one way or the other. And what's the difference between 23 and really 20? You know, it's somebody's life, and we can't really regulate because we don't know enough about it. It's better to ban something and then try to bring it back than it is to let somebody go through the heartache that we're seeing just with this one family. And the other person who spoke last time was a person from Worcester who isn't even here tonight again. My email is completely filled because I've been standing here trying to push back. They printed a flyer with our email, city emails on it, to send a generic broadcast to us every single time they do it. So I can't even get through my regular emails now. But again, it's a purpose that we really need to take on. And as Ms. Churville just outlined, I think it's going to have the domino effect with other communities around us. And when more heads get put together, I think it would be a much better way to bring this back to the table after we ban it. So I would implore that all of you take the first step and be the leader, as this board always has been in the area. We're not always like that on the city council. We always have to reference other communities on every action we take. Well, Cambridge does this, or Watertown does this, so we should do this. I would rather that they reference us and we save lives. So I thank you for all your hard work that you do and this tough decision that you would make. Thank you.
Thank you. Anyone else?
Hello, my name is Holly Druval, 230 Pawtucket Boulevard. Yep. I already came, this is the second time I am in front of the board, so you know how I feel and what happened with my son. I do just want to reiterate why I feel there is a ban, there should be a ban and not a regulation. If you did your research, you will know that 90% of the people that have died from kratom are over the age of 21. If you research it, so to ban something and say it's allowed 21 and older, well, the majority of people dying are older than 21. So how much good is it just to regulate it? Banning it and gathering the information. And I've spoken with representatives, state representatives, and so many more people are becoming so much more aware of this. If you watch the Energy Commerce meeting, you would have saw the representative from Florida. Her 5 minutes that she was allowed was solely spoken on kratom. That was 2.5 weeks ago. You could actually pull that. So this is a concern that is growing. I think it's moving its way here more so, and I think that's why we're starting to see it even more so here in this part of the country. But it has been around for a long time, and again, the majority of deaths have been for people over 21. I want to thank you for your time in whatever decision you make. Thank you.
Thank you. Is that everyone? Okay. Does the board have anything else that they want to say?
Sure. So I actually spoke to the HHS director of Quabbin County just because I wanted to know kind of how it came about for them, and of Belchertown is part of Quabbin County, it's a tri-county board of health. So I just wanted to know like how it came about for them and what the process looked like and how they were doing enforcement, because they're a town of 15,000 people. There's one recovery center, one dispensary, an adult smoke shop, and then like a handful of tobacco permits. So it kind of came out preventatively for them. The recovery center had brought it to the board's attention, it's very similar to here. And then they kind of went forward. They had, it has so far been very similar. So they did their public hearing, very similar to like last month, people that showed up. It was a very similar situation, but their enforcement was very different. So because they're under Pioneer Valley, which is 31 cities and towns, their tobacco control is under 31 cities and towns. So they had to separate it. It got stuck in their law department for a little bit under enforcement because the HHS director is actually in charge of enforcement. She has to go out and check, but there's not that many places. So it would look a little bit different for Lowell. But they said that it's been going very well. They really haven't they had one store that had it, they removed it from the shelves, and things have been going pretty well for them since. So my only thing is I think if we restricted it, it's kind of backhandedly saying that it's okay for people over 21. And I don't think that's something that this board has ever really worked one way or another. We didn't do that with the deltas. I don't think we should do it for this, so it's just my thoughts.
Thank you. I also, I think we should send the regulation to ban kratom to the law department. I don't think we should wait for the state or the FDA to start regulating it. I think we need to do it now. It's clear it activates the opioid receptors in the brain. It's addictive. There's the person who spoke last month talked about using it to help him withdraw from opioids, but then if you stop the kratom, you go into withdrawals. And he, I think, admitted that. So I just am you know, the FDA says it's a drug of concern that they're looking at, that they need to do something about. I'm not sure why we in Lowell need to wait for the FDA or the state. We never have before waited for those folks to regulate something that we think is unsafe. And it's funny, in my news feed this morning on my phone was another person who died in another state from kratom and was over 21 also, as was mentioned. So having it be allowed to be sold to over 21 people does, I think, send the wrong message. Everything I've read about it says, you know, there's varying amounts. There's no, like, standard because it's not regulated, and that obviously there's been a lot of toxicity at different doses, and I do think that the way to go is banning it, but I'll do whatever the board wishes.
I agree with the ban also, because it's not regulated. There are other options for people who are in recovery to receive help. Standardized medications and protocols that help people to recover and achieve sobriety and a more productive lifestyle. So I feel like switching to something that's unregulated is in varying quantities with constituents within the formula that are not known is sort of a dangerous precedent to set. I think that until there is a clear regulation for this and a clear formula for what this would entail, I don't really think it's a safe thing that we should have on the shelf.
It's rare that I can't add anything, but I'm going to be quiet and say, yes, I agree.
If I may, before you take a vote to decide to send this to the law department, do you want as a board to do anything about that provision tonight? And the reason I'm asking is because we can just simply remove that provision, or you can just come up with a very simple way to say, hey, if you have so many violations within 36 months, you're going to come before the board for a revocation hearing. Because if I submit this to the law department with a question, that might take longer.
I thought that the concern was only in the draft with regards to restricting the sale, not banning.
No, it's in both.
No, it's in both.
What I would submit to you, Caesar, is I would just take out egregious, leave it at 2. 2 offenses mean you come before this board because there's no allowance for selling it. So if you've sold it twice, that's egregious enough. That would be my votes. Take out the word egregious, and after 2, you come before this board.
No, I totally understand what you're saying, but the problem is it overlaps with Section 2.
Right.
So, because we say, hey, no, if you have a first offense, it's $1,000, $2,000.
I would take out the third
Just
offense.
take the word out.
I would take the third offense out. You get fined once, you get fined twice. On the third time, you're getting your license revoked.
Then I recommend that you sort of like, you make a motion, make that change on this draft. If you want me to remove item number 3 under Section 2, in case of 3 or more violations, if you want to just say, $1,000 for a first, $2,000 for a second, in suspension, and then anything after that will be considered to be egregious and not for revocation, we could do that as well, but you need to instruct me to do it.
I don't know if anybody else feels differently at all, or?
Right. I mean, it's, unless,
Motion to change the language for Section 2 to take out egregious and say third offense, you come in front of the board for revocation.
I'm sorry, say it again?
So for the third offense, you come in front of the board for revocation.
For revocation?
Yep.
All right, so we remove we remove number 7 because we don't have to define what egregious violation is. And then if there's a third or subsequent offense, a third offense, then it'll be up for revocation. Do you want to have an option to say, well, at the third offense, we either revoke or suspend, or you just want to go for revocation in 3 violations?
Well, I think there's always room to have a hearing and hear their side of the story, right? So I don't have a problem.
Right. Well, let me just say.
This is, you're talking about this regulation that's a ban.
Yes.
You're not talking about like tobacco regulations where something sold to minors the first, second, third.
Right. Exactly.
Them selling a banned substance.
My-
The
my-
third time.
Third time will be a revocation hearing.
What do you think?
hearing.
Again, the hearing, I think there should be a hearing. My concern is the ability to mask kratom in other ways that maybe somebody could sell it and not realize it. This potpourri issue or whatever, where you're not intentionally selling it. That won't be true at a tobacco place, but it might be true at a convenience store where they're selling potpourri or something, they don't realize kratom's
Except
in it.
it's the third
Could do
offense.
3 times, though, you think?
Don't get me wrong, you know I wouldn't be sympathetic, but I just don't know that that's not possible. So I'm just saying a hearing, to me, they deserve a hearing. If they don't have a good, if you don't have a good explanation for why it keeps happening to them, then we'd revoke them. But I don't want to necessarily make it automatically revoking. I want us to be able to meet and have a hearing to decide that, I guess is what I'm saying.
Right, and I think you have the right to do that. The only caution that'll make is this. Anytime you open the door for doing one way versus another way under similar circumstances, then you open up yourselves up for being sued, for example. Because if there's a circumstance where we have a third violation, you decide not to revoke at that time, but you revoked somebody else before that one, then you're in trouble. So that's why my recommendation would be have a black and white. A third violation would be a revocation hearing. If they can show it didn't happen, they're off the hook. If I can show that it did happen, you agree with me, then they're revoked.
Doctor, do you just want to add in there for possible loss of license?
Right, a revocation hearing, right, but there's another problem. Let's say, for example, this establishment doesn't have any licenses or permits issued by the Board of Health. Now, they only got a fine of $1,000 and a fine of $2,000, and that's it.
Well, that's why I'm saying if you had a hearing, they could still come to here and we could fine them $5,000. We could, in theory, we could make a decision to.
But that's the thing, that's why if I were to suggest something, I would say, well, leave number 3 under section 2, in case of 3 or more violations within 36 months, you still get the $5,000 in fine plus suspension of any permits. But if they don't have any permits, or if you decide, well, come up with an additional rule on top of this one to revoke their license. Because if they have no license issued by the Board of Health, at least we can issue $1,000, $2,000, $5,000. If they don't have anything, right, so at least they get those fines. If they do have them, then at a certain point, you'll have the ability to revoke their.
So the third one should be $5,000 fine and revocation.
Okay, I like that. All right.
I mean, I don't think we're really expecting clothing stores to start selling kratom.
But people might get creative if they're not.
Exactly.
If they do, then.
But they have to have some type of a license from us if they're selling
Right, I mean,
something
there must
that
be
they're
something
eating.
that
Like
they're-
there has
Not
to be a
if
food
it's,
license
not if
from
it's a
us.
prepackaged thing, I mean, right? No.
What's that?
No, they don't have to have, you don't have to have a food license to sell.
No, but do you have to have a commercial license?
Some kind of city permit or license.
Permit?
It could be any. Well, the thing, I'm sorry to cut you off. I mean, because the language says you could suspend any permit issued by the Board of Health, not by the city. So it could be, in theory, a clothing store that decides to sell kratom. If we leave it the way you just suggested, they'll get a fine of $5,000 at third or subsequent offenses. But if you say, well, at that point, it's going to be $5,000 in a revocation hearing as opposed to a suspension hearing, then you decide whether to impose that revocation or not.
I guess our question would be, is there a way, again, this is a lot of time on theory, right? But if a clothing store had 3, could we not ask the city to put something in the permitting for commercial licensing, something that says if you have 3 of those, you lose your license to have a commercial entity and you get closed down? Same as a tobacco store.
Right, so what would.
We don't have the authority, but the city does, right?
Right, what
So
would prevent them from just keep selling, 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 selling?
Right.
No, I.
Yeah, the thing is, I don't know, I mean, the legality of you compelling any other department in the city to suspend the permit that they issued. I don't know how that.
let's work on ours, but then we
Yeah,
could make a
let's get-
recommendation, they
let's
look
get
at it.
It's a good start.
Yeah.
Let's start here.
So, there's an amendment to the ban. There's an amended regulation to the ban.
There's an agreement to the ban, and under the section with the fines, we're going to go the last one was a $5,000 fine, not a suspension, but a revocation.
Can we have a motion to send the revised ban to the law department?
Let me get this motion first here, though. So right now, the motion before the board is to remove section 7 And then to change section 2 to remove the, not remove the third fine, to add to the third fine.
We're going to remove, well,
The license revocation hearing before the Board of Health regarding revocation of Board of Health permits or licenses.
instead of suspension, revocation, yes.
I have a procedure question. So Belchertown did a public hearing following their vote. They did a public hearing and they had their city solicitor in the hearing. I don't know if did that negate them having to send it to the law department because they had the law?
No, we have to send it to
Okay.
the law department and then schedule the public hearing.
Okay.
And the city solicitor will be here at the public hearing.
Right, you could decide to pick that date for a public hearing tonight if you decide to do so, or you can just wait until, the law department provides their opinion.
Well, are we hopeful that it would come out of the law department in time for the public hearing?
Well, we could pick the public hearing for the December meeting, because it would probably be out. We may not have it for November, but if there's a change between now, you may have to vote on it for November to make sure. In case there's a tweak for the November meeting, we could have the public hearing for the December meeting.
But we won't advertise that until you confirm it in November, right? So this is just
We have to advertise it 2 weeks before.
right, this is an administrative decision let's consider December for a public hearing,
Right.
but we're not going to publicize it until we confirm it from the law department.
We'll probably have a goal for the first week of December for a public hearing, as long as we can get out of law and it's good and we don't need a vote for November.
Well, I'll try to make this as easy as possible for the law department to make a decision on. I've been lucky in the past. The turnaround has been quick.
Okay, so right now I have the motion that nobody recorded. Okay, so just so we're adding license revocation hearing before the Board of Health regarding the revocation or suspension of Board of Health permits and licenses. By Bill?
I'm sorry, could you just say revocation and suspension?
Revocation or suspension.
Is that, it's just revocation? I have it.
And then I just need a motion to send it to the law department.
Motion to send it to the law department. Second.
And I'll make a motion to get rid of 27.
Very good, that was perfect.
Thank you very much.
Can I just ask one more question? So one of the things that the city council had was that they wanted they're putting a letter together to go to the delegation to support a ban for the state of Massachusetts for kratom. I just wanted to know if the Board of Health would like to support with them a statewide ban of kratom, if you would like your secretary to put a letter together for the delegation to support a ban for a statewide ban for Massachusetts. Yep.
Motion to support.
Talk to the boss at the end of the table.
The next item on the agenda is the monthly development services report submitted by Matthew Shipping.
Evening, everybody. As you can see in the handout that I submitted, we have 2 new restaurants for this time frame. We had 2 failed restaurants for this time frame. As you can see, I put both either the past or failed dates as you guys have requested. And then, the chunk of the report this time for this month is the schools. So as you can see In my report, there are there are 4 schools that failed during this time frame. Do you want me to read them? Do you want me to go through it, or?
So I guess, a couple of things off the top that stand out. The rodent issue and the fire extinguisher issue. How do you have a fire extinguisher twice failed on an expired fire extinguisher? I mean, I'm just curious, who's checking the fire extinguishers?
So,
Is that somebody's job?
Well, I mean, it's my understanding that the company should come in, whether it's annually, biannually, for the fire extinguisher. Fire extinguishers are good for a year, so they should be coming in on a yearly basis. Unfortunately, for the Butler, it didn't happen.
Did they not come in and inspect it for a year?
I'm not sure. It's just from the outside looking in, that's.
Failed the last time.
Right.
The fire extinguishers had expired.
Right.
3 fire extinguishers were expired. I mean, it failed on April 23rd, expired fire extinguishers.
Yeah.
Jeez, I hope they never have a fire.
So do I.
I'm sorry.
It's the same,
And it's not, I'm not coming at you, it does stand out a little bit.
is it the same company that services all the schools?
Yes.
So we have the same company, all the other schools are able to somehow pass, but this one keeps failing. So what's going on with that school that they can't get in there?
That I don't have an answer for.
Okay. So who in the schools would have an answer to that question?
I have an answer to that.
Great.
We contract with Impact Fire to do our fire hoses, our inspections.
Sure. For LTC.
Good evening, everybody. So the school department contracts with formerly ASAP Fire Protection, now it's Impact Fire. They do all of our inspections. They do it twice a year. Actually, I'm sorry, they do it once a year and twice inspections on the hoses. The Butler School was replaced today. Typically, I don't go out and check all the fire extinguishers. We rely on our custodians, senior custodians, to report to us that they've been completed and done. Unfortunately, the Butler School slipped by me. We made a phone call when we found out about it. It's been replaced since then. Lowell High School was replaced also. I think last year Lowell High School also failed for a fire extinguisher in the new kitchen. So again, those have been inspected and replaced today.
Okay, so there is someone in the building that is responsible for checking the fire extinguishers.
They are. So we're going to start doing things a little bit differently and get a little bit more communications out with our senior custodians who are really responsible for the ins and the ongoings of the buildings every day, and start treating them more like managers of the building rather than just being in charge of cleaning it. Going out, making sure that, back checking on the companies to make sure they're doing what they're supposed to be doing. Very typically, they come in, we take them for their word that they've all been done, and we don't go out and, typically go out and check everything. We have hundreds and hundreds of fire extinguishers throughout the building, not just the kitchens. So we'll start making that a priority of the senior custodians to back check all those extinguishers, to check the tags. So from here on in, so
if a fire extinguisher was expired, would it still work fairly well or not? I don't know.
possibly.
Just a question.
Yeah, possibly.
I'm an optimist.
Yeah, very typically they'll take them out, check their pressure, and bring them back. I'm not sure what they do after they take them out of there. But very typically they're the same fire extinguishers that come in with a new tag on them. So.
Okay.
So I have a question.
So go ahead.
So when Matt goes in to do an inspection, or whoever's going into the schools to do an inspection, they have a list that they're looking at, like a checklist.
Yeah.
Is there someone in charge in the schools that has the same checklist that goes through, and goes around with Matt so that they're like looking at those things, or like, what's the?
No, nobody, it's one of the things I'd like to suggest is that we accompany, myself or my now assistant accompanies them on these health inspections so that we have somebody that's responsible there for it, rather relying on 28 different senior custodians. It'd just be more helpful if one of us could accompany Matt or whoever the inspector is on these health inspections. And also for our own insight into mice droppings and that type of stuff. You know, we hear from health inspectors that they're seeing evidence of mice. We hear from kitchen staff that, it was, 1 or 2 mice poops underneath the cabinet, and, we shouldn't be failing for that. But again, I think it's important that somebody from our department accompanies with them. And I don't take anybody in their word, and that's why I think it's important that somebody in charge of the buildings, myself or John Leahy or one of my other assistant, tags along with these. The other thing is we're making preparations now, and I know Alicia is here today too from Food Service. She's sent out instructions to their their cook managers to clean in the morning, in the afternoon, underneath the storage, in the dry storage rooms, and then we're going to start following up on that. For years now, as long as I've been here, food service employees, even before AMAC, took care of their own kitchens. There was no oversight or cleaning by the custodians in the building. It was almost like a separate entity of the building. We're going to change that. So again, I'll be checking kitchens from here on in. My custodians will be in charge of helping clean those kitchens, which is something new. There's been a little pushback on that because it hasn't been done for years. We never cleaned the kitchen. So we're going to start taking a different look at how we do things in the kitchens. And so I won't have to come here on Wednesday nights and you won't have to see me.
Yeah, thank you, because there's a big rodent problem everywhere in the city, and it's very frustrating to see the schools where kids are continually over and over and over again be here for rodents. And I know that it's a big job, and I know there's a lot of reasons why this can occur, but it's good to hear that you're going to be making a more hands-on approach to inspecting yourself.
I will be. I personally, a couple of years ago, we had a real problem with the mice. They were overrun with mice in the buildings. I think we've made a lot of improvements in the last few years. We've got more of a schedule set up with Baines Pest Control. They're coming in the first week and the third week of each month. So we have a better time rather than just when they show up, they show up. So we're putting things on schedules. We're going to be checking on buildings. But it's important to know that when the schools aren't like your normal restaurant in the area that may see 25, 30 customers a day, may have one door and one delivery door. We have hundreds of doors in our buildings. We have classrooms that have breakfast and lunch served in them throughout the building. So because we're looking at the kitchen area, that mice might be coming from the second floor. Not all of our teachers move their boxes, look behind shelves, and really track what's going on in their classrooms. So we just have to get a better understanding of what's going on in our classrooms, and we're educating our custodians a little better on mice and just not leaving it up to just one particular or 2 particular teachers that are being thorough in their classroom. So how it works is if a teacher or a staff member sees an activity of whether it's a mouse or ants, cockroaches, whatever, they communicate to the senior custodian or the custodian team. That custodian is responsible for logging it into the logbook, and it's Banners, I'm sorry. Sorry, pal. Their responsibility to come in and check those logbooks and treat according to what's in that logbook. They don't treat 150 rooms in the entire school. They treat what's in that logbook, but what they do treat is the kitchen area, the dry storage, and the teacher's room, regardless of what's in that logbook. So it is very difficult, and very typically you're going to see mice droppings. What I've noticed is where the sightings are underneath the dry storage shelves, and that's where the bait boxes are. So if there are mice coming from upstairs or coming from a different part of the building or coming into the delivery door that day or whatever, that's where we're going to see them, where the bait boxes are. So again, we have to do a better job of cleaning up. We need to accompany them on their inspections so that we know what level of mice poop and sightings we're seeing, and treat accordingly.
So if there is
Go ahead.
if there's breakfast or foods being served in classrooms why is that not being looked at as well? Like, is that not being inspected? Or I'm not certain what that's
No,
all
it
about.
is, well, it is. But, I mean, we clean the rooms every day, but teachers aren't moving boxes that are in shelves. They're not moving boxes that are on cabinets and stuff, you know, and nor are custodians. They're coming in, we're cleaning the carpets, we're cleaning the floors, we're wiping down the desks, we're doing the window sills, we're washing the windows, we're replacing lights, but not necessarily on a daily basis are we moving boxes out from corners of classrooms. Anyone that's been in a classroom or an elementary class or even a middle school, they're packed. You know what I mean? So there are things that get by the everyday cleaning.
Is this, the food that's being served, is that part of like a program in the schools, or is that just individual?
It's called grab and go now, where we used to have breakfasts in the cafeterias. Now to save time and to.
They all eat in the classroom.
Yeah, you walk into the school, there might be a different cart at couple of different locations. Kids grab their breakfast and they go to their classroom and they eat lunch. That's new in the last, 3-4 years maybe.
Yeah.
So we've introduced food to
Food to the whole building.
every space in the building. Yeah, I agree, but that's the world we live in now. So, you know, we've gone from food in the cafeteria, in the kitchen, maybe in the teacher's room, where it was a little bit more easy to manage. Mice are going to go where the food's at, plain and simple. Now we've introduced food to every corner of the building. It's a lot more challenging to keep them under control.
Mm-hmm.
We also have deliveries throughout the day, whether it's food products, paper products, you know, school supplies. So there's a lot of in and outs. We have a lot of, we have recess doors that are opened. There's just a lot more ways into the building. So there's a lot more oversight that needs to go on.
I'm just not sure how logistically, because I assume that the health inspections are not like planned, or they just random?
No, they're random, and there's a point to that. Like, I don't want to announce that I'm coming
Right.
to X, Y, and Z, when, if they know we're coming there,
Yeah.
all the problems might be taken care of, and we don't see them. So the whole idea is to not surprise people.
Yeah.
But, just to
Right.
show up.
So I'm not sure how that would work with this, having someone from the schools accompany you, because you
Well,
would.
they have to plan with them, they would have to coordinate, that's all. Right? It's one of the leaders, so they just tell the leaders we're going.
Well, you get this back and forth, where we're talking to food service employees that are in the kitchen, directly in the kitchen, and saying, hey, what's going on? They're going, oh, there was three teeny mice poops underneath the cabinet, and we failed for it. And I just sent an email. I sent an email to Sean, a couple of people, asking, are we talking about a mice infestation? Are we talking about a couple of sightings?
Frankly, I don't think that.
I can assure you that I'm not failing the school for just simple mice droppings. If we see an amount, we write it out.
Yeah.
Yeah, I mean,
We're all thinking any dropping isn't.
Yeah.
I don't nitpick. It's not my style to. Like, if there's like a very small amount, that we can talk to the kitchen manager about that and say, hey, listen, you got to sweep this up, you got to take care of this, or you're going to have a big problem.
I mean, and not to sound rude or anything, but the schools that all failed for mice droppings failed for several other things other than just mice droppings.
Right.
So, I mean, again, we can nitpick
My
the amount
perception
of
is 3 mice
droppings, but it's other things too that these schools are failing for, so.
It's not just
You say there's a lack of attention to detail in these.
Yeah, or maybe oversight, like maybe hopefully this new plan will help it.
And I hear what you're saying, Rick, about, there's food in every
Yeah, it's so hard.
classroom.
I have no problem showing up at the school, getting into the cafeteria, and then calling somebody in charge and say, hey, we're actually in the building, if you want to meet us here. But I'm in no way, shape, or form, I'm not going to give a list ahead of time.
Right.
I'm not, forgive me, I'm not saying any mice activity is acceptable, but what I'm trying to explain is there's a lot of ways into the buildings, there's a lot of
There's no way to get rid of the mice completely.
there's no way to get rid of the mice in the schools. I mean, there really is.
Maybe Rick wants to comment on that from being.
I've been here several times in front of this board,
Yeah.
years ago, several years ago, when we came in with pictures of food, left out in classrooms. We
Yeah.
still talk about that.
Yeah.
We talk about doors that don't have door sweeps in them. You know, we talked about it 4 years ago. A lot of effort went into taking care of that. But now we're 4 years down the road, or a few years, and we're still faced with the same challenges. Food in the classrooms, teachers bringing stuff in that are in plastic, that aren't in plastic containers. Doors being left over when it's hot in a kitchen, or a teacher's out at recess and they've got a door propped open. It doesn't take very long for a mouse to come in and do what they do. It's not of lack of effort, I can tell you that right now. We put,
No, it's not.
Yeah,
that.
yeah.
no, but I mean, we've put a lot of effort into trying to control mice in our buildings. We meet with Rick all the time. We talk with the food service people all the time. We've stepped up our cleaning, and it's very, very difficult. It's not because our 4 or 5 years ago, you could go walk into a school and there would be times where you could see the mice running around. We've come a long ways with our mice, but it's a constant battle. It really is. I'm not saying anything's acceptable, and I'm not making excuses. I'm just telling you it's very difficult with the amount of food, the amount of lunches we serve, the amount of cafeteria, breakfast and lunch, snacks. I mean,
Yeah, it's too bad that I think it's too bad, but like you said, it's what's happening. Breakfast and lunch happens in the classrooms.
Yeah.
And
we have bait all over the place. We have bait in classrooms. We have bait hiding in heater vents in the classroom. The other thing is we can't put sticky things out in the middle of a classroom. We can't put bait out in a classroom. We may not be able to use the type of stuff you may be able to use in your home that may be a little bit more aggressive, or spray the outside. We're limited in what we can do, but we try to stay on top of this. We really do. And like I said, a lot of effort and a lot of money has been put into trying to take care of this too. It's DPW, teachers, custodians, pest control. These are all people that all are trying to, that have to do their part in order. And it only takes one or two people not doing their thing.
Right.
That brings
We get
it
that.
back
So
to the building.
I do have a question for you, though. I mean, money's an object, don't get me wrong, but are there things that if we had funding, you could do to make it better? Or are you saying, no, we're pretty much doing everything we could possibly do?
Pretty much doing everything we can do, unfortunately. Like you mentioned, we're very limited what we can do in classrooms around children, and with bait out, and with sack school boards, anything that they can get to is tricky. So controlling food and the reasons they're in these places is the start. Right. And then everything else kind of follows suit after that. We've got systems set up in every kitchen, in offices, custodian areas, everywhere that we can. But when it spreads past that, that's where it takes cooperation on everything, which I think we're starting to get now.
If you don't mind, I could address some of the other things that are on this list too.
Sure.
So the hand washing, paper towels and soap at the Lowell High School. That part of the high school just opened up this year in August. I wasn't aware until this came out that they didn't have paper towel holders put on as part of the install. So those were delivered today. They'll be in place for tomorrow. Same thing with the soap. There's 4 locations at the servery at the new Lowell High School cafeteria that has a sink that has no soap dispensers or paper towels.
What Rick's talking about right now will be on the next list.
Oh, okay.
Oh, okay. Okay, I was just going through the deficiencies that I have on my list.
On the list for next month.
Great, it will already be fixed.
Well, that won't be on the list for next month.
The 4 schools that you have here were between the time frame, like
Right.
they started the first of the month of September. So these are the 4 schools that failed during the reporting period.
I just had a question. What is the difference between the Ansel system being non-compliant and being out of date? Are they essentially the same thing? Because one report, like for the Shaughnessy, it says Ansel system is non-compliant, and then for the STEM, it says Ansel is out of date. So is it like the same things, or?
So non-compliant means there might be a couple of nozzles that come out of the top of the system that aren't what they believe in the proper area. So they might have a kettle or a cooktop where there's not nozzles coming down, which puts the deterrent for fire retardant out. Out of date means it's just expired. So every 6 months that needs to be checked. So that's the difference.
So the last time that you were here in front of us, I think there was an issue with the Ansel system and like it being Airmark versus the school. Has that been resolved? Like, we know who's making that phone call now and
It
getting those
is.
services?
So it's, under the contract, it's still under Aramac's supervision, but what we've talked about on the city side is that the buildings still belong to the city, and we don't feel that it's fair to have people that are in charge of cooking the food necessarily be in charge of the mechanicals on the building. Although they're still going to be part of their contract, is paying for it out of their contracted revenue, but we're going to, myself, the facilities department and the DPW facilities department will start overseeing the repairs to these. So Aramac and food service directors will still be paying for it, but we'll be having oversight over the repairs. And yes, some of the differences, first of all, they've all been inspected this year. Some don't have tags because they're out of compliance for one reason or other. We're working on that now to have that remedied and fixed, repaired.
Maybe you could come back after you've implemented some of these changes and just chat with us and update us as to how you feel it's working.
Absolutely.
Thank you very much. Anything else?
I really didn't mean it was acceptable for my spoon, just I was trying to explain.
It's okay. Thank you. I think we're all set. Oh, Matt, I did have one other question. So I think last month when you weren't here, we had a question about the places being inspected every 6 months. And I know that you were down inspectors and then new people, and this month there still appears to be some places that it's been 10 months since they were inspected. Would you say that the goal, or that that you are working towards, that they can be and will be inspected closer to 6 months than 10 months?
Oh, absolutely, yes.
Okay.
There was a little, staffing
Yeah.
going on there, so a couple of things, were extended, took a little bit longer to get to, because there were, myself and one of my team members, Clement, were doing a majority of the inspections for the entire city, but going forward, hopefully, the board won't see that anymore.
Okay, great. Thank you.
Thank you very much.
Thank you. Thanks, everyone. Have a good evening. The next item on the agenda is the Pride Star overdose report as mailed. Any questions? The item after that is the Board of Health calendar as mailed. Do we have any conflicts or questions about the next year's agenda or dates? I mean, next year's.
You didn't do December's next year?
Yeah, that was missing.
And it was always the first week. I have a conflict with that, so, including this December.
Maybe that's why I left it off there.
Maybe,
Do we want it on the 3rd?
If you want to make it the 10th, I could be here on the 10th, but I can't be on the 3rd. I know that opens the 3rd.
Are other folks hopeful to be here on December 3rd?
The January meeting won't be till the following week because the 1st is that Wednesday, so we'll be
Okay, go with the
closed.
calendar.
So this would be the 1st of, oh, wait a minute, what am I
Are you
doing
talking about 2026?
26.
Mm.
Oh, no, that would be 7th. That would be the 7th. 5, 6, 7, that would be the 7th of January.
Yeah, let's, so, does anyone else have a problem with December 3rd? Okay, so if it's all right with you, we'll just leave it.
Go on without me. And the rest of the dates are...
You and I will be going right now.
Rest of the dates are fine, I know.
Okay, so do we don't need
Yeah, just a motion.
do we have a motion to accept the proposed Board of
Sure.
Health calendar for 2025? Okay, thank you. Next item on the agenda is the addition of Christine McMahon Poltar as second burial agent. Do you have a motion to approve,
I
Chrissy?
didn't have that.
There's no paper. It's-
Oh, okay.
Oh, sure, I'll make that motion.
Second?
Second, yeah.
Thank you. The next item is the modification to the Board of Health Body Art Apprenticeship Regulations. So after we passed the regulations, we realized that there was some training requirements that we put in for people at the beginning of their apprenticeship when probably it should have been minimal requirements at the end of their apprenticeship. So we're looking for a motion to modify the requirements in the body art practitioner license apprenticeship program by adding the following to the apprentice license, section 2A, A2, I'm sorry, in addition, to say, in addition, apprentices in the field of microblading shall be exempt from section 10.05 minimal training requirements, section 3, during their apprenticeship period. Do we have a motion?
Where is this?
It's in our,
It's on the agenda.
You wrote it on the agenda. But you have,
That's the language, so you can see what we were changing. So right
this is
now-
as is.
Yes. So we.
Adding to 2A2.
So the first page is the regs that are referred to in the apprenticeship program. So right now,
That's fine.
the only thing that's excluded in the training is section 10.56B and 10.56C, which is just that they have to have 2 years of experience.
Right, got it.
It was brought to the attention of the board that the microblade practitioners cannot get the certificate that you guys have voted for them to get. So this is now going to exclude 10.5, or 10.03, which requires microbladers, when they become practitioners, to have either that certification from CCMP or the, I can't remember the name of the other one. So the two organizations that license, that do certification.
This is not materially different from our intent, it's just clarifying that one.
So it's removing that requirement, so they don't have to get it until they're becoming a practitioner.
But can I just say something? I don't think that, so this is the apprentice, but they can't get it until they've been a microblader for 2 years.
So they have to pass the. Look at it again, we just removed the requirement for them to get it while they're apprenticing.
Not the microblading.
So right now, what it says in the apprenticeship is that they would have to hold a, what was it called? A certification. From one of the two things. But they can't hold that unless they've been a microblader for 2 years. So we have to strike that because as an apprentice, they can't do that. So they just want to be an apprentice. But once they go through the apprentice and they become a microblader, I don't think that they can get that right away. They can't get gold right away.
One of them does and one of them doesn't. Go ahead.
So what happened is that I have a big thing.
But I don't think, right as soon as they pass the apprenticeship and go on, I don't think the day that they pass the apprenticeship, they can get it right away, can they?
No, because
How long do they have to practice on their own before they can get this?
at least it's 4 hours. I'm not gonna say right now because I don't wanna say wrong. But what happened is what was discussed here was that was the person giving the training should be part of the association, right? That was what the board got in agreement here in the meetings. And then what was done when passed to paper was that the apprentice had to be in the association to go through the apprenticeship. That's not possible. That's put the person in a loop that she can never get apprenticeship because to be in the association, you have to have your apprenticeship done.
Right, so we understand.
Yep.
We're gonna change that.
Yep.
Yeah.
The question is, when you finish your apprenticeship, how soon before you become a member?
So to become a member, you're gonna have to have the apprenticeship.
Yeah.
You're gonna have to work to submit the work. You're gonna have to have all the certifications they ask. I cannot give you a time frame for that. As long as that person fill all the requirements, if she can do in 1 month, she can do in 1 month. If she can do in 2 months, she can do in 2 months.
Right, but my question to you is this: you're going to have an apprentice come in and work with you. They're going to finish that apprenticeship, and then they're going to want to be able to practice that skill
Yes,
on people,
yes,
which means they're going to need to come here and get a license to do so.
yes,
And the requirement to get that license is to be in one of those memberships.
yes.
So what we're asking you is, if we wanted to allow them to get that license without the membership, it can't be indefinite, because we want them to get that certification. What's the reasonable amount of time?
Oh,
apprenticeship
okay, now I
that
understand.
they have to achieve that certification, or they don't get the license here, or they can't keep the license here? Is a year enough?
I think 1 year is a good time frame. Since they finish off the apprenticeship to get that. Now I understand what you mean. Yeah.
Because otherwise, they get the apprenticeship, they'll never be able to get the license.
Okay, so I went through the whole paper, and can I just read a couple of things that I observed? Sorry? Yeah, sure. I appreciate it.
I'm sorry, what did you say?
I just went through the whole document, the new one, and I took like some notes. That's what you guys have in there. And I would like to go through.
So, so you're proposing now 7 or 8 new changes to the regulation?
Yes.
Okay, so that was not on the agenda as far as I knew. So the only thing on the agenda was this updated change to the apprenticeship. We were not aware of other changes that you were interested in making to the regulation.
Oh, I just said if I could speak, I don't know, I had to specify each one of the things.
Okay, well, it is on the same topic, but
Some
this,
things are just common sense. It's not really, a big change. It's just common sense.
Well, with all due respect, we've been talking about this for a year.
I know.
We went through this a lot of detail, and I thought you were here last time when we did approve it.
Yes.
And I thought we were pretty purposeful in some of the decisions we made. Now, the one about the apprenticeship, like, that's clearly just a mistake on our part, not our intent. But, for instance, if you want to sit here and tell me that instead of 25 procedures, they should only have 5 procedures, and only have done 3 before they're done the apprenticeship, then we're going to have a bigger conversation, because I don't agree with that.
I understand, but this is what the other cities are doing.
You heard us just vote to get rid of Kratom. We're the first one in the state to do it. We're not necessarily interested in what other people are doing. We want to know what's safe for our consumers here. And I'm not going to tell you that it has to be 25 and 15, but it's not going to be a simple, I agree, make it 5 and 3. That's not going to happen tonight or tomorrow or next meeting. There's going to have to be a little more conversation about that.
I understand. I understand that, yes. I just want to get to attention that it has to be something that's viable to do.
I understand that.
Right now, as artists practicing for so long, sometimes we are not doing 5 people in a month. How come, if you close your eyes now, I'm not talking to Dr. Gavin, of course, but as a woman, if you close your eyes right now, do you think you can get 15 friends to come for you to practice on them?
I can tell you that I wouldn't want someone to do my eyebrows that hasn't done it on 15 or more.
Right.
Dr. Galvin doesn't have 15
I don't have friends, so.
You also have to be able to repeat the skill with enough frequency to ensure that the person has a confidence and skill level. And if you're only doing 5 a month, like you're saying, and you might have 4 interns, that doesn't seem like a viable, simply by the numbers that you have, not viable because that's what's required for the skill.
Oh, I'm not just saying comparing to what I have in right now as a client. I'm saying that's okay if you don't want to do 5, that's okay. But 25 people being observed, that's excessive. That's
Where did
like
that
a
come
lot.
from? We didn't just make that up ourselves. I thought that came from
Yeah, we
one of your
borrowed,
bodies, governing bodies.
is it Arlington or Boston
No,
or
at the
something?
time I told what the other cities are doing, and you said that was
So that's where it came from, somewhere else.
that
Okay.
was you were looking for. And I'm just saying, it's a lot. We're gonna try, but we're gonna try our best to make the person have all these people in, but it's not something that's very viable. Another thing that I didn't understand and I wanna ask is, when you say one student per time, is we are watching one person at the moment while the person is doing a client, or if we're giving apprenticeship to one person, we can just give apprenticeship to one person? Like if the person is doing a whole 1 year apprenticeship, we can just have that one student? Because
That's how it is for the tobacco,
No, it's one.
one per person.
It's one apprentice at town or one, okay. And that's based on the tattooing
That's where the
regs, right?
tattoo artists are also. So I just went online, and the gold, they've added another level to their program, so they now have a community membership, which does not say it has to have any kind of training. So it looks like maybe this is, other places may have fallen into this. Because now the gold membership requires to get it 100-hour micropigmentation training certification, which I believe is what our apprentice program is, 100 hours, right? I don't have it in front of me. Or proof of 2 years of industry experience. So there's a difference. But they now have a lower level one also. Community membership, which is a general membership.
That make no sense is try to obligate a person that is doing apprenticeship to enter the association as in the community, pay for that, when the person is already paying for apprenticeship and also have to already be a member as a gold in the end of the apprenticeship. What are the persons going to be getting being part of the association while she's still in training and learning process?
We already said we're gonna waive that.
That's not even here. That's, I think she is saying to be added.
No.
No, that was what was on, that was the original that was on for tonight, that we're waiving.
All right.
That was the original thing that was on tonight that we're waiving. Yeah.
For the sake of this part, I think we
Yeah.
all agree to change and waive the requirement and make that change so that apprentices can practice without being a member. That I think we can all agree on, right?
Well, first we have to send it, we have to make the motion to remove that from the regulations and send it to, and a motion to, a vote to send it to law. Then you can make a motion for us to temporarily not enforce that part until we have the public hearing and it becomes official. So that's the second motion.
So do we have someone making the first motion to send modifications?
Second.
Okay, and then to send modifications to the law department for a public hearing?
No. I don't think we should do that until we sort some of this.
Not all these modifications, you're talking about that one.
Just the
Just that
one
one
modification.
But if you're gonna change everything
Yeah.
else, then you.
I
We're
don't-
not
I
going to have 4 public hearings, right? Let's just-
Right,
let's
no,
just
no,
hold
no.
this
Well,
one.
I don't have any, I mean, these aren't on the agenda tonight, so, and, I mean, this stuff should have been brought up, frankly,
Already.
for the last 2 years when we were doing the regulations.
I didn't knew, for instance, like, I didn't even knew when we discussed that the apprentice would have to be part of the gold, as a gold in the association, because that was not what was said here. So you have to remember that English is not my first language, and sometimes what I understand.
I understand, but we're correcting that tonight.
Yeah.
By the motion that was just made. So they will not have to have that certification during
I
their
appreciate
apprenticeship.
that, yeah.
We will fix that tonight, because that's what's on the agenda. But these things that were handed out tonight, the board is just seeing for the first time. So.
Yes, I totally understand that.
Um,
I just want to bring that, the awareness for that, because if I never say, it's never gonna be said. right? So another thing that me and Leticia was talking is the fact that we have to renew our license until December 31st. And December is usually a very busy month. If we could change that for January, that would make things so easy for us because
Why is it December?
I'm sorry, we can't do that. That's based on the city's regulations. So all of the permits and everything are due, like the tobacco permits or everything are due at that time. So that's, yeah, that's based on the cities. Yeah.
Oh, okay,
Yeah.
okay,
Yep.
okay.
Yeah,
Because just,
Yeah.
yes.
Yeah.
If we can renew earlier, that
Oh, yeah.
makes things easier because
Yep.
December is really like a hard month to do this kind of stuff.
Okay.
So another thing that I was looking at is in one paragraph says that the person giving the training is responsible for all the procedures that are being done. It is also responsible for the person that is having the apprenticeship and the training. So I think when that is said, I would understand that the insurance being used is the insurance for my place, and the person's gonna be added to my insurance as addition, like a person that's coming in practicing. I don't think they can get.
Your insurance company just has to issue a statement saying that they're covering it for you.
Oh, okay.
You don't have, they don't have to go out and buy their own.
Yeah.
You can insure them, but your insurance company has to have a statement saying that we're covering the insurance of the
Your
students.
insurance should cover the trainers.
Yes,
The
because
training.
I don't even think they can get insurance
No,
without
no.
being finished.
No, but it's just the way you're
No,
thinking
it's
it.
your
Your insurance is such a,
Oh.
you just have proof your insurance is covering it, that's all.
Okay, okay, I see. So it's basically all this.
Right, so if you look at this list real quick for you, paragraph 12,
Sorry, one
cross it
more,
out.
just one more.
Okay.
The monthly reports, like, can that be a report when the person is ending the apprenticeship? We're gonna have to be sending reports monthly as the person go by? I think it's just easy when the person is done and the person gonna be coming through the board to give that report when the person is done with the apprenticeship.
So that is a mirror of the other artists, the tattoo artists do monthly reports. So we were setting the same standard for,
What's the report, just the total cases? What's it actually on the report?
What is it? on the
No, there has to be, so the tattoo apprenticeship, they have a task list with stuff that they have to do within, and then they have a time log. So showing how much time they spent, so to show that they're reaching there. And then, so they send a copy monthly, or I really ask them to send it every other month or once a quarter because it's a lot.
Right.
So we get copies just to make sure everybody stays on track. At the end of the apprenticeship, they have to do a cover letter stating that, the attached originals that they have been keeping are true and that the apprentice has met the requirements of the time and the training, and then they send it all to me. They have to get that one page certified, so they have to bring them to the notary together, and then they sign that cover sheet in front, and the notary stamps it.
so they send them to you every other month.
Well, they were coming with the monthly reports, but now that we're not doing the monthly inspections anymore, so they usually collected with the report, but now we're doing that every 6
Do we
months.
need to amend the tattoo
I don't know.
rules too, then? Or you just leave it as once
I
a month
thought
and allow you-
I don't have the regs in front of me, because I wasn't expecting these questions, so it's
Right.
kind of hard to answer, but I think we might have revised that
Okay.
I'd have to go back and look, though, I just don't have
To
access to
say
them right now.
every 6 months?
I think I put a less frequent turn-in when we redid the apprentice, because I knew that they weren't sent in.
Right, so what we're saying is,
I have to-
if it says once a month, it's gonna stay once a month, but you're gonna talk to the health department about a reasonable time frame.
I mean, basically what we ask is that when they come in for the inspection, that you hand it to them.
Right.
So if Matt's only coming in every other month, then it would be every other month. If it's 6 months, then it would be 6 months. But the problem is 6 months is a very long time to know that
Right.
somebody is
Not
not
meeting the
doing what they're
milestones.
supposed to
Right,
be.
right, right. Do you understand that? We want to know that your apprentices are progressing, so waiting until the end isn't really how we want it. We need an update on how they're progressing, but it doesn't have to be monthly necessarily.
I appreciate that.
He's not going out every
I
6
do
months.
understand
Well, that
that
was
things
going on
happen
and then
to
you guys
people.
decided to
And
go back. So I have
I
to work
think
it out
that
with. in
even
the
if you're not
application
doing the
which I-
progress, like continue, as long as you keep up and do all the work you have to
Right.
get done.
Yep.
If you have 2 years to do it, as long as if 1 month you didn't did much, but the other month you did everything you didn't catch up in the last month, you shouldn't be punished for that, I think so. As long as what you have to get done is being done.
So there's no time requirement or activity requirement that's done? So basically, the time log just says, I came in these days and worked this many hours, and then the next month, you may have worked 20 days and did 4 hours a day, and another month you may have worked 10 hours and 6 hours. So
There's no
it's just-
punishment.
There's
Oh,
no
okay.
punishment for it, and then.
It's a record.
It's just a record of what they're doing.
Oh, okay.
Yeah, and that, that you say on this month that you did, because you have to go that year, so you probably end up going to go over that length of the hours anyways, because it's a minimum 1-year requirement for the training. So like the tattoo artists, they're 1,800 hours within that 2-year period. A lot of people hit that like at 17, 18, 19 months, depending on how often they go in, so they still have to do that extra time, because the apprentice license requires 2 years. So now with the microbladers, that's requiring 1 year to get everything done. If they finish in 6 months, they still have to finish out that year doing practice stuff, according to the regs.
So Kerry will look and see that was changed in the, what really happens in real life is that you would be asked to give the apprenticeships monthly reports to the health inspector when he comes out, right?
But he's not
Except
coming
now he's
out
coming out.
monthly.
So you wouldn't worry about it. It's
So
not your
just-
responsibility.
yeah.
It'd be when
Yeah.
he shows
As long
up.
as you're
Pat.
Okay.
documenting monthly. you
Okay.
can-
Because-
I may have put in that they're responsible to get them in every other month or every quarter. I'd have to go look. I don't remember.
So
off
we'll
the top
check
of my
on
head.
that.
But that would
Yeah.
just be
But-
taking copies and popping them in the mail to me and mailing them to me.
Okay,
For example, what Carrie just said, we didn't had understood that. What we understood that the person had 1 year to complete the apprenticeship or 200 hours. For what I understood that what she just said,
It's probably what it says. I think you're right. We don't have this is why we don't want to talk about it.
okay,
Because we don't have it sitting in front of us. We can't
Yeah.
reference it. I think you're right on that. She's trying to quote from memory, and we're going down a path we don't need to go down.
okay,
You give us this, we can put it on the next agenda.
Okay.
We've given you some general answers now.
okay.
I would suggest you rethink the 5 and 3 as being unrealistically low and not going to be acceptable by this board.
You actually lowered it to what we have in the
Right.
regs. We had required more than that initially, and then Julia talked and we lowered it, and you told her at the time that's what you wanted.
Right.
okay, so we've actually talked about most of these items.
Right.
The trainer's insurance we discussed is your insurance
Not
covering the
right.
trainer.
Yeah, the two outstanding things are the first one about the number of students, and then 10.05, which is the 25 and 15. I think all the rest of them we actually have addressed,
Right.
so.
So,
you can-
I don't think the board has any appetite for decreasing the number of procedures.
Okay.
But
I don't have a problem if you want to decrease the number of observed procedures, but performed, yeah, I'm
So do
reluctant
you
to.
want to not make the motion to change right now and the motion to sit, and just right now hold that requirement until the board has a chance to review the regs, make any changes, send it to the law department?
We should probably start all at
I'm
once.
not interested in reviewing regs, but,
It's up to you, whatever you guys vote, or whatever.
I
motion
think
you
we
wanna
should
make.
get the motion on record of, because it's in the current regulation, of waiving the.
Yes, that we need to change now.
So right now, Kathleen and Ally voted to remove that, to change it to that, remove that 10.03, I think it was. The next motion was going to be to send it to the law department. Do you want to hold off on that, or do you want to follow through with that? And are we
Well, if we're gonna put it on next month's agenda, we guess we have to wait to send it to the law department, right?
Yeah.
I'm just not sure.
Does anybody have an appetite to expand? You have to understand, we created this as a new thing. You might think about holding off for a year before you come back and saying, I want 4 apprentices, because I don't know if anybody has the appetite to say, sure, let it just run wild with 4 apprentices from day one. We might want to see how things go with 1 apprentice and leave it open that we could expand that and change that regulation down the road. I'm just not sure I want you to have 4 apprentices tomorrow when you're telling me you might do 5 cases in a month. How are you going to get 4 apprentices, enough cases over the course of a year, if you're doing 3 or 5 a month? That's not, I don't understand how you could have 4 apprentices and give them the proper education that they need, right? So you might stick to the 1. I might tell you to just let that go unless everybody else says, nope, let them have 4. And we can think about the number of cases they observe and stuff, but I just don't know that you're going to
Question, are the
get that.
apprentices bringing in their own people to do the procedures on? Is that the issue?
Mostly, that's how it works.
Yeah.
And for me, it's not a question of appetite, because this is like what I do for a living, so it's not like I can have appetite or not to deal with this. It's just...
I'm saying we don't have the appetite, not you.
I understand that. I understand that, and I respect that.
Yeah.
And I really don't want to come back here every month. But I also have to have something that's realistic for me to use in the day by day and to have. And I have been talking with people that work in the other cities, and what I am saying here is what other cities have been practicing for a long time with success. It's not like I'm asking for something that is very odd or not normal.
I'm sorry to interrupt you. I think, Dr. Galvin, first of all, we did ask you on many, many occasions to show us a regulation from any other city that justified those changes. I don't believe we ever got that from you. Second of all, we have our own standards, and we're really not looking to find a city that has a lower standard. And so we're trying to be empathetic to your plight, and we want your business to succeed, but we're really not looking to have some city somewhere in the state that has a lower standard. And if you can find a regulation from another city that has a lower standard, we'd be happy to read it, but for 2 years, we did ask you to provide that to us, and we did not get that. So if you can name the city and provide us with the regulation, we'd be happy to review it. But we have been discussing this for 2 years, and at the final public hearing and discussion, we thought we had met all your requests, but we hadn't, and we did look at this, and we are happy to amend the regulation around the apprenticeship. But now, tonight, before this is even, the ink is dry, you're looking to make more changes. And so that's where we're coming from.
I do understand, and I do appreciate everything the board has done about this matter. I really do appreciate it. It's just what I said. I want to be realistic. I want this to work. I want the city to be reference of people coming here and getting apprenticeship. And different standards don't mean lower standards. It's just different. Okay?
No,
I really do appreciate
but again, yeah, from my perspective, you're going to start you're starting to do a procedure, or something that we've never done before here. And at the same time that you start doing it, you now want to introduce apprentices coming in here and doing that. And there's a process that has to be followed. We just talked about the once a month and all this. There are things kinks that need to be worked out in the process to make sure it's done safely. So what I'm saying to you is, I would not vote for you to have 4 apprentices tomorrow. I want to see how 1 goes. I want to see that you actually do the right thing, that you do the right reports with the health department. You come back in 6 months and they say, everything's going great, this is really working great, and you want to say, I want 4, then we talk about it. But I would not vote for that on day 1 when we're still trying to figure out the process and how many, literally to me, I want to see you do this, show me you can do it, show me that you can be compliant, then come back and ask for more. That's what I would recommend for you.
Okay, I appreciate that. I really appreciate
Yep.
it. I do understand. I really just want to put it out because if I don't say, we'll never be said,
Correct.
right?
Right, right.
Okay.
Okay.
Thank you.
Okay, so I just need a motion to hold a requirement for that certification from the apprenticeship until such time that this goes to the board, the law department, and it goes to public hearing.
So are we sending it to the law department?
No, that didn't pass, that motion didn't pass.
Well, we didn't pass
We
it,
didn't-
but now that we've gone through all the lists, and it really just comes down to procedures and whether we would reduce them at all. Again, I'm not opposed to reducing observed procedures, I just still think you need to do 51.
What she's saying is it's difficult for her, like when, say I want to do this, I have to have 50 of my volunteer friends come and let me practice on it, is basically what, she's not using known customers
Not
that are just coming
customers,
in.
right, it has to be, so it has to be your own friends that will do it?
Like you have to get the
You
volunteers
have
to
to
come in and
find
do
the
it, right?
volunteers.
And that's what the difficulty is for her.
But the 50, I wouldn't change the 15 procedures done.
I've never done the procedure, for all I know, you need 2 and you're an expert, I have no idea. But I thought we based that on.
We
other
had a higher
requirements.
amount before based on, I pulled from 6 different communities, maybe 7 or 8.
Right, that's what I thought.
And the numbers we had originally were in the other town's regulations, and then at the public hearing, she spoke about it, and we cut that down already. And then we cut something else down. Again, I don't have everything in front of me,
Where are you
but
getting the numbers 5 and 3? Abington?
they were one of the towns we looked at.
Find the Abington thing, will you?
And I'll-
When you say this, 25 procedures done, does it include both sides, or is it just one? Like if someone watches you do one side and they do the other, does that include like one?
So usually that's not how it works. So
Oh.
usually when the person is learning, we do the outline and the person follows the outline. We just don't let the person, when they are starting, just go and do themselves. So I don't even know if that will count as us doing or the person doing, because we cannot just let the person do.
Right.
First we go and do, and the person just go and.
Goes, fills in, kind of fills in. Okay, okay.
They're using the instrument and they're using it on a person that counts as one of their cases.
But they'd have to do enough full cases on their own in order to be perfect.
Okay, so do we need to put this on next month's
Yeah, I think
agenda?
so, yeah.
Okay. So we'll,
I need to.
we're going to have to get the regulation out, get some of these towns' regulations out to reconsider the number of procedures observed and done.
Okay, so we'll hold the law department until we,
Yeah.
next month. till we
Right,
do that.
but I need a second on the motion to hold the requirement until such time.
Who made the
Kathleen
motion?
made the
I'll
motion.
second it, that's fine.
Okay, so I guess we'll see you next month.
You might as well just get a seat right here.
You guys, I'm
Dr. Galvin does need.
I won't even do
I
that.
need my eyebrows taken care of, for sure. Okay, we want to get it
I haven't
right.
even had a chance to make the forms, because every time I'm gonna make the forms.
Okay. The next item on the agenda is
Animal control.
animal inspection approval for,
Make a motion.
second,
Second.
Jacqueline Palencia, nominate her as Inspector of Animals.
Make a
Okay.
motion.
Yeah, thank you.
Oh, okay.
The next item on the agenda is the Cashins and Associates Air Quality Report for LHS. It looks good. Any questions? Next item is COVID updates, availability of free COVID test 19 kits. Did anyone bring some tonight or not?
I have a present.
Madam Health Director?
Did you have a question for me? Yep, there. Oh,
So there's COVID kits, there's a flyer.
Yes.
Packet, where people can place an order to get free COVID.
right, starting September 23rd. We can get 4 free at-home COVID test kits, and I believe the school department did post this on their social media, and so did the city. covidtests.gov.
Okay, and then, what? The next item on the agenda is communication with regard to the fact that suspension of spraying for,
Wasn't that a last month?
It was mentioned
was
last month, but it
mentioned.
wasn't on the agenda.
Do we need a motion?
no.
Great.
The next item is the director's report. There's the public health nursing report and substance abuse division report. Any questions on those two reports?
I think in your packet, you got the flu vaccine information that the city is going to start doing flu vaccines, but I did hand them out to you guys as well for the Tuesday clinics at the Health Department at 107 Merrimack Street on Tuesdays, starting, I didn't keep one for myself, the 22nd, I believe, 2 to 7. And COVID vaccines are available at Walgreens and CVS. 4 to 6? Okay.
Yes, Tuesday, October 22nd, 4 to 6 at the Health Department, and Tuesday, October 29th. There is also availability, I think I mentioned last month for the viewing audience. If you have anyone that would like, that's homebound, that needs COVID or flu vaccines, you can call on the in-home vaccine central intake line at 833-983-0485 to make an appointment for COVID and flu vaccines. It's a Department of Public Health program, in-home vaccination program. And they do have them available now.
Were you able to make an appointment?
I did.
Oh, great.
For a family member.
Fabulous.
Hey, Lisa, can I ask one quick question about the report? Hepatitis B.
Oh.
It went from 78 and 23 to 561.
Yes.
Is that just better reporting?
I think, so what's happening is anybody who has like certain criteria, now they're testing more people. So there's a different panel that they're doing. So everybody's like ruling into like certain criteria and they're testing more people is what's happening. So, yeah. I think Nicole had done something probably 3 or 4 months ago. I'll ask her to put it on next month, just so that we see that, yeah. And then there was a change, I did send it to the chair for her, the TB. She had put 2 rows together, because what happens is we're following the suspect and active TB cases. They're all being followed for like the 8 weeks, and then they fall off. So because we follow them for the 8 weeks, there's a lot of work being done on those 2, so she's combined the 2 columns, and then she gives you the how many active cases we're actually doing DOTs on, so she does give you that column of how many active TB cases we have. So she's gotten rid of 1 row, and that's what happened last month.
Okay. Anything else for the director's report?
Nope, I'm good. Thank you.
Getting them a new car.
Oh, co-op and the syringe coordinator. 2 new cars.
So yeah, I did speak to Matt tonight.
Thank you for having me, so please. Sorry.
Haven't seen you at the gym.
I know, starting Saturday. What gym do you go to? We're back to swim. Yeah, so it is. Back to swim starting Saturday.
Won't see me Saturday, maybe next week, we'll see. Thank you all.
I like this good. Yeah.